Welcome to the Doctoring 1 core exam video. The core exam is the very brief screening exam performed on all patients regardless of their presenting concern. After washing your hands, begin the exam by briefly observing for signs of distress, discomfort, and level of nourishment. For the external eye exam, make sure to use a light source against the wall or using a pen light. To visualize the scleral conjunctiva, pull down on the lower lid and have the patient look up, then pull up on the upper lid and have the patient look down. You can do this one eyelid at a time or simultaneously and have the patient look up and then down. Doing it simultaneously may also allow better visualization when the patient looks side to side. When checking for pupillary reflex, ask the patient to look into the distance and shine a light obliquely into each pupil in turn. Observe for both direct and consensual pupillary reflex. For the oropharynx exam, again use a light source as well as a tongue blade. Use the tongue blade to push down on the tongue to better visualize the rise of the uvula, the tonsils if they're present, as well as the posterior pharynx. You'll also want to use the tongue blade to push against the buccal mucosa on both sides and observe the gums and the buccal mucosa. Finally, ask the patient to lift up their tongue. When palpating lymph nodes, use the pads of 2 fingers with a gentle rolling or rotary motion. When auscultating for heart sounds, have the patient in a sitting position and ask the patient to remove the shirt or lower the gown so that you can adequately assess the positions. After confirming that your stethoscope is in the diaphragm position, palpate the sternal notch. Just to the right and below it is the right second interspace. This is the aortic area. On the other side of the sternum in the left second interspace, you'll find the pulmonic area, and as you go down the left sternal border to approximately the 4th or 5th interspace is the tricuspid area, and laterally to nearly the midclavicular line is the mitral area. For some women with pendulous breasts, you may need to ask her to lift up the breast in order to listen to the mitral area. Next, you'll want to repeat the exam with the bell of the stethoscope in the same areas as you did for the diaphragm. Be sure when using the bell of the stethoscope to just apply as little as pressure as possible to create a seal. Next, for pulmonary auscultation, you want to switch back to the diaphragm of the stethoscope. Instruct the patient to take a deep breath through their mouth on your command or each time they feel the stethoscope placed on their chest. Listen to each position through one full inspiration and expiration. As you can see, I'm auscultating on symmetric areas of the chest before moving to the next position. In the back, we're auscultating 3 posterior and 1 lateral position in an approximate L shape. Essentially, we're trying to avoid listening over the scapula. On the anterior chest, we're listening over the apices, which are above the clavicles. and one additional area on each side of the anterior chest. When examining the abdomen, make sure you're standing on the right side of the patient and pull out the footrest as the patient lies down for comfort. Ask permission from the patient to lift up the gown and make sure you're able to see all 4 abdominal quadrants. For female patients, lifting the gown to the broad line should be adequate. During inspection, look for any scars, erythema, or guarding from the patient. When palpating, start with superficial palpation with one hand and palpate with a light, gentle dipping motion in all 4 quadrants. Assuming there was no significant tenderness to light palpation, move on to deep palpation using 2 hands. Use the hand on the skin to sense the underlying structures, and the top hand to provide most of the downward pressure in a dipping, sliding motion. After helping the patient sit up from the exam table, let's move on to the extremity exam. We're going to be examining the lower extremities for pretibial edema, as well as dorsalis pedis and posterior tibial pulses. To find the posterior tibial pulse, first palpate the bony medial malleolus, then place your fingers just behind and below it. You may have to apply varying pressure to feel it adequately. To feel the dorsalis pedis pulse, it may be easier to first have the patient extend the great toe. The pulse is usually found just lateral to the extensor tendon in the midfoot. Pretibial edema is assessed over the bony tibia. Use your thumb to press down over the bony tibia for at least 2 seconds. Observe and feel for any residual depression that remains. Assess strength by asking the patient to put their arms in front of them and push and pull against your resistance. Next, have the patient lift up your thigh against the downward pressure of your hand on their thigh. Finally, have the patient walk across the room and back and observe their gait.